Hello everyone, welcome back to Pharmacy India. As you all know, Government of Telangana has released vacancies for the pharmacists. So Pharmacy India has taken an initiative in which we have started a mock paper series for your preparation, and this series is especially for the South Indian students. As you all have commented in our comment section that please provide the solution of the questions, of the most important questions which are really helpful for our preparation, and please provide the solution in the English language. So we have started this series, and today we are going to start mock paper 6, and which will be of hospital and clinical pharmacy. So in today's lecture we are going to start mock paper 6, which will be of hospital and clinical pharmacy. So let's start. First of all, if you are new on our channel, please subscribe the channel, and you may please download the Pharmacy India mobile app from the Google Play Store, because you will get the latest updates regarding all the vacancies and all the books or courses in this app. And you may also go through the pharmacyindia.co.in on the Google. As you type this pharmacyindia.co.in in Google, you will get the latest updates regarding all the pharma updates, and you will be getting quizzes, daily job updates, previous year papers, current affairs, subjective blogs, college details. And this is our official website of Pharmacy India, in which you are going to get all the details and all the updates of the pharma. Now we'll start our session. Before that, you may also follow us through various platforms like WhatsApp and Telegrams. We have provided the links in the description. You may go through them. Now we'll start our session. First question will be, OTC drugs are, means over the counter drugs. Over the counter drugs are what? And we have given the options. First option is they do not require prescription. That means the doctors writing the prescription for the medications which we are going to show the prescription to the pharmacist at the pharmacy stores. Next option is saying sold against the prescription of registration medical practitioner. That though the medications which we are going to sell, or the medications which will be sold by the pharmacist against the prescription. Next option is required to be used under medical supervision, means OTC drugs are those medications for which we need medical supervision. And last option is all of these, which would be the right answer of this question, which will be saying that these are OTC drugs. And the right answer is option number A. That means ki which do not require any prescription. OTC drugs are simple over the counter drugs. OTC drugs are stands for over the counter drugs, which means ki we do not require any prescription of the doctor. We just go to the pharmacy or the medical shop or the medical store, and we say please provide me this medication, or please give me this medication or this medicine. So he'll not asking the pharmacist which will be present over there, he would not ask you regarding the prescription. He just give you the medicines and take them the money for the amount which he is going to sell. So over-the-counter drugs do not require any prescription. That is why the first option is correct. Next question is, CROs stand for. What would be the full form of CROs? In pharmacy, what we are going to spell CROs? First option is Contract Research Organization. Second option is Controlled Research Organization. Third option is Contract Risk Organizations, or the fourth one is Controlled Risk Organization. And the right answer for this question, which is option number A, Contract Research Organization. CROs stands for the Contract Research Organization. Now the question arises, what is Contract Research Organizations? Simply, we can call them as clinical research organization also, because it is a service organization which is providing supports to the pharmaceutical industries and the biotechnological industries in the form of outsources pharmaceutical research services, that is for drugs and as well as for the medical devices. Means they are providing the full support to the pharma industries and the biotechnological industries regarding what? Regarding the drugs and the medical devices which the industries required mostly. Next question is, OPD refers to. Now what do we call OPD? And the option are other patient department, second option is outpatient department, third option is other pharmacy department, or the fourth option is out pharmacy department. What would be the right answer for this question? That is OPD. What do we spell out the word OPD? And the right answer is outpatient department. Students, you all know very well that outpatient department is only just in which patient do not require to admit in the hospital more than 24 hours. He just go to the hospital as he has taken an appointment from the doctor. Doctors would be diagnosed him and they'll send him back to the home. Means outpatient simply which do not require overnight stay in the hospital. They do not require to stay in the hospital for the overnight. That means that they have to visit the hospital, just simply taken the prescription of from the doctors. Outpatient departments are those simply which do not require any overnight stay in the hospitals. That means they simply take appointments from the doctors on the phone calls or through, or their family members go to the hospital and taken the appointment and bring their patient to the doctors. They diagnose them, they check them, and after the checkup they provide him the prescription, and after the prescription they'll get the medicines from the pharmacies, either in the hospitals or outside of the hospitals. So that simply we can say that outpatient department are those for which they do not require any overnight stay in the hospitals. Next question is, what is the normal range for fasting blood glucose level? Means on empty stomach. On empty stomach, what would be the fasting glucose level? What would be the normal fasting glucose level? Options are 60 to 90 mg per deciliter, or 120 to 160 mg per deciliter, or 200 to 250 milligram per deciliter, or last option is 300 to 350 milligram per deciliter, mg per deciliter. And the right answer is option number A, that is 60 to 90 milligram per deciliter. Because on empty stomach, our fasting glucose level must be 60 to 90 milligram per deciliter, because this would be, it would be reflecting the normal glucose level of our body. If it is above the 90, that means ki 90 to 100 or more than 100, that means ki the patient is diabetic and his or her glucose level would not be normal. He will be called as, or she will be called as a diabetic patient. Next question is, the normal range for the total cholesterol level is generally, means what would be the normal total cholesterol level of a normal person, of a human being? Options are below 100 mg per deciliter, or 100 to 150 mg per deciliter. Next option is 200 to 240 mg per deciliter, and the last option is 300 to 350 mg per deciliter. And the normal total cholesterol level of an individual, of an human being, is 200 to 240 milligram per deciliter. If the amount is arises, or the amount of the total cholesterol level is rise above the 240 milligram per deciliter, that means his or her cholesterol level is not normal, because this value includes low density lipoproteins, that is LDL cholesterol, and high density lipoproteins, that is HDL cholesterol. Means, and the other lipoproteins are also there in this value. It means if the patient is having, or if an individual is having the amount of 200 to 240 milligram per deciliter of the total cholesterol level, that means his or her LDL, HDL and other lipoproteins values are normal. And if the number arises or it rises above the 240, that means it is increasing above 250, 260, that means his or her total cholesterol levels are not normal. Next question is, the abbreviation NPO stands for what? Would you call this term NPO? Because it is a Latin term. So what would be the meaning of this NPO? And the options are non-prescription only, or nothing by mouth. Next option is new prescription order, and the last option is nighttime patient observation. And the right answer is, for this NPO full form, it is the nothing by mouth. NPO means nothing by mouth, because NPO is a Latin word in which the abbreviation is nil per os. in Latin, it is stands for nil per os. That means ki nothing by mouth, because this term simply says if we cannot take anything from our mouth. Doctors are using this term. That means if the doctor is using this term, that means simply is ki we have to not take this food or this medicine by mouth. Simply is that. Next question is, a hospital is called large if it has bed. A hospital is called large if the number of beds are between this and that. And the options are more than 500, or 400 to 1000, or 500 to 1000, or more than 1000. What would, when will be called a hospital? It is a large hospital according to the number of the beds. Options are in front of your screens, and the right answer is more than 1000. We call a hospital is a large hospital when the number of beds are more than 1000, because a large hospital contains 1000 or above beds, and a medium hospital contains 500 to 1000 beds in that particular hospital, and a small hospital contains 100 to 500 hospitals in that particular hospital, and a hospital is small if it contains bed less than 100. So according to the number of beds, you can now classify the hospitals according to the number of beds, ki what is a large hospital and what is a small hospital, etc., according to the number of the beds. Next question is, how many pharmacists are required for a 100-bed hospital? Means if a hospital is containing 100 beds, then how many pharmacists are required for that particular hospital? And the answer is 10, or 6, or 5, or 2. What would be the correct answer for this question? And the right answer is option number C. It requires only 5 pharmacists. I'll show the table. In this table, you may are going to understand ki what would be the number of the pharmacists required according to the number of beds. If a hospital containing 50 beds, then 3 pharmacists are required. If a hospital contains up to 100 beds, not more than 100, up to, that means ki 100 or below 100, it requires 5 pharmacists. When a hospital contains 200 beds, it requires 8 pharmacists. When a hospital is containing 300 beds in that particular hospital, it will require 10 pharmacists. And a hospital is containing up to 500 beds, then it will require 15 pharmacists in that particular hospital. So now from this table, you are going to learn what would be the number of pharmacists required for the particular of hospitals according to the number of the beds. Next question is, choose the hospital classified based on the cost. Now we have to choose a hospital on the based of the budget, or you can say that on the cost. And the options are budget hospital. Next option is a small hospital, or medium hospital, or large hospital. What would be the correct answer for this question? And the right answer is for this question is budget hospital, because in this question we have asked that how will you classify a hospital on the basis of the cost, because there are so many classes of the people which are going to take the advantages of the hospital according to the cost, because there are some people who are not going to afford that much of amount as a high class person is doing. So that is why hospitals are classified as a budget hospitals according to the cost, as per the cost. Large hospitals are costly, and elite hospitals, they are affordable by only high class peoples or rich peoples. Next is medium hospitals. They are low budget hospitals, and small hospitals or very small hospitals are for free hospitals. You can say that free hospitals, that means ki medium hospitals and small or free, small and very small hospitals are affordable by the medium classes or the low classes according to the cost or based on the budgets. Next question is, the minimum training hours required for the pharmacy registration is dash hours. How many training hours are required for a pharmacist to get his or her registration as a registered pharmacist? And the options are 800 hours, or 100 hours, or 500 hours, or 300 hours, and the right answer is, you all know very well, that is 500 hours, because the PCI has set an statutory, that is, if a student has completed his or her D Pharma and he or she is going to get a registration of a registered pharmacist from a particular state, so he or she has to submit his training certificate at least of 500 hours, that he or she has completed his 500 hours training, that is 500 hours simply is of 3 months, minimum of 3 months. And if he or she is submitting his training certificate to the particular state of pharmacy council, either you may belongs to UP or Telangana, or you may belong to Rajasthan, so you are going to submit your training certificate to the pharmacy council, and you have to complete your training of 500 hours or 3 months of training from the government recognized hospitals, not from the private hospitals. So a PCI has certain rule, that means ki if a student has completed his or her D Pharma, he or she has to submit a training certificate before the registration of a pharmacist. Next question is, pharmacist is the link between the, question is simple as that ki pharmacist is playing a mediator between the two peoples, and they are, options is doctor and nurses, or medical profession and public, or medical practitioner and pharmaceutical industry, or medical practitioner and medical profession. And the right answer is medical profession and public. That means ki pharmacist playing a mediator between the doctors and the patients, between the doctors and the patients, because in the medical profession they are doctors, they are nurses, and they are pharmacists also. Pharmacist is playing a linker, or it act as a mediator between the patients and the medical professionals, that is nurses or either the doctors. So it is a mediator between the medical professionals and the public, that is patients. Next question is, who will act as the chairman in pharmacy and therapeutic committee? PTC stands for pharmacy and therapeutic committee. So in this committee, who will be the chairman of this PTC? Means pharmacy and therapeutic committee, and the options are pharmacist, nurse, lab technician, or physician. And the right answer is option number D, physician. I'll show the composition of the pharmacy and therapeutic committee. According to that, you are going to learn who will act as a chairman, who will act as a member or a secretary. If we are going to talk about the physicians, there are number of 3 physicians in the PTC, that means pharmacy and therapeutic committee, and 1 physician will act as a chairman. There are only 1 pharmacist who will act as a secretary of pharmacy and therapeutic committee, and they are members too, that is administrator will act as a member, and nurses professionals will also act as a member, and the number of the administrator and the nurses are only 1 each. Next question is, there should be minimum of pharmacists in primary healthcare center. How many number of pharmacists would be present in the primary healthcare center, that is PHCs? And the options are, only 1 pharmacist would be required, or 2, or 3, or 4. They have asked you regarding the minimum number of pharmacists required in primary healthcare centers, and the right answer is only 1, because if we talk about the pharmacist in primary healthcare centers, that is PHCs, so we required minimum 1 pharmacist over there. Minimum 1 pharmacist over there. You may hire 2 or 3 or 4. That is depend on the government or the district government of that particular district or that particular state. So that in PSCs, primary healthcare centers, we required minimum number of 1 pharmacist over there. Next question is, first in first out method, that is FIFO, means FIFO method is a method associated with, FIFO method is associated or related to which? Purchase procedures, or codification of items, or inventory control techniques, or pricing of material. And the answer is very simple, that is option number C, inventory control techniques. First of all, we have to understand what is inventory control. Inventory control is simple as that कि we have to maintain a stock of our business, and we are talking about the pharmacy. If we have opened our pharmacy, that is medical shop or medical store, so we have to maintain a proper stock of the drugs. For that we are going to follow the FIFO methods, that is first in first out method. The product we have bring first, we will sell out that first. So it is totally related or associated with the inventory control techniques, because we are going to maintain our stocks. Next question is, which of the following is not a method of inventory control? There are four options in which we have to analyze that which would not be a proper or which would not belong to the method of inventory control, and the options are systematic want book method, or ABC analysis, or AMZ analysis, or economic order quantity. And the right answer is option number C, AMZ analysis is not a method of inventory control techniques, and rest options are the methods of inventory control techniques, that is we are going to maintain a stock of our business, and there are various methods by which we can maintain our stock, that is we can maintain our inventory, and these are ABC analysis, Ved analysis, EOQ economic order quantity, lead time, buffer stock, and the systemic want book method. Next question is, patient counseling is done by who will do the patient counseling of the patients? Options are dispensing pharmacist. Dispensing pharmacist means a pharmacist who is going to give the medicines to the patients. Next is pathologist, who is going to doing the test of the patients. Next is clinical pharmacist, or last option is none of these. And the right answer is option number C, clinical pharmacist. Clinical pharmacist is only the pharmacist who has taken the responsibility of doing patient counseling of the patients, who is going to define all the procedure of the treatment which is given by the doctor to a patient, because the patient is going to ask various questions from the clinical pharmacist ki why he has written or she has written these medicines, which disease I am suffering from, and what is this disease, what are the symptoms. That these are all questions which are going to be asked by a patient from the clinical pharmacist, and the clinical pharmacist is only the person who is going to do the patient counseling of any patient. Next question is, in the composition of pharmacy and therapeutic committee, the pharmacist work as, in the previous question which was related to the PTC only, where they have asked if physician will act as a, who will act as a chairman, that is physician, and in this question they have asked pharmacist will act as a, in pharmacy and therapeutic committee options are secretary, chairperson, administrator, anesthetist, and the right answer is option number 1, secretary, because in this particular pharmacy and therapeutic committee, medical staff will act as a chairman and the co-chairperson, and the pharmacist will act as a secretary, and nursing staff will act as a member, and also the administrators will act as a member or the director. Next question is, computers in hospital pharmacy used to maintain. Why we are using computers in our hospital pharmacies in the hospitals itself? And the options are drug records, patient records, both A and B, or the none of the above. And the right answer is option number C, that is computers are used in hospital pharmacies because we have to maintain proper drug records and we have to maintain also the proper records of the patients. That's why these both methods are used, because in drug records in a hospital pharmacy, computers are used because we have to maintain a proper detailed record of the medications, in which inventory management are also there, drug dispensing and the tracking, and we are going to track the use of particular specific medicines in our hospitals. Next is patient records. Computers are used in hospital pharmacies to maintain a proper record of patient records, because manually it is not possible to maintain all the records of all the patients who are going to visit the hospitals. That is why computers are used to maintain proper records of the patients. In a just simple click, we are going to see the proper record of any patient which we want. Next question is EOQ stands for. EOQ stands for, it is related to the, it is a method of a inventory control. Options are electronic obtained quantity, electronic order quantity, economic order quality, or economic order quantity. And the right answer is option number 4, that is D, economic order quantity. It is a method of a inventory control technique. Why we are using this method? Because we are using this method, the quantity of a material which we are going to be ordered at one time, it will be minimizes the cost. That means if we are ordering the material or the product in a bulk quantity, so it would be automatically minimizes the cost of all the bulk drugs or of all the bulk products we have ordered. And if we are ordering that particular amount in parts, so we are going to pay the amount of that particular orders at a particular time periods in large amount. Next question is, computer based PMRs are used for maintaining. We are using patient medication records through the computers because we have to maintain patient medication records, or we have to maintain prescription of prescribers, or we are going to monitoring the adverse drug reactions, or we are going to maintain the inventory control. And the right answer is computers totally are used in hospital pharmacies to maintain a patient medication records, because a computerized pharmacy system in hospital should going to maintain patient medication profiles, prescriptions generated by the doctors, medication list which would be going to dispensed by the pharmacies, proper record of the patients, medication history of a patient, and the account of that particular patient in a hospital, and the inventories. So a computer is going to help in these particular fields in our respective hospital pharmacy. Next question is, essential medicines are those medicines. What are essential medicines? The question is simple, is that what are essential medicines? Options are, they are those medicines which are needed to treat emergency conditions, or they are those medicines which are need to treat serious diseases or severity of the diseases. Next, they are those medicines which are going to satisfy the priority of the population in respective healthcare needs. Last option is, they are recently introduced in the market, and simple is that they are new in the market. And the right answer is option number C, they are going to satisfy the healthcare needs of the patients or of the population of all the countries of or the continents. And now I am going to explain the what is essential medicines. WHO has defined the essential medicines. They are those medicines which are going to satisfy the healthcare needs of the population of any country. In essential, E is effective and economical. S is for safety, as these medicines would be safe for the patients or those who are going to use these medications, it would be safe. Next, S is for single drug formulation mostly. Next, E is for environmental factors are also considered while making the choice of the drugs, because environmental factors can also affect the efficacy or the potency of a drug. Next, N is for the majority of the population they needed the drug. Next is T, they must be available at all the time, means 24/7 they are going to available. Next is I, in proper doses form. Next is A, aim is to optimally use these medications in limited financial resources also. And the L is of list of essential drugs is made locally with the help of WHO model list, because they have go through the WHO model list in which they have mentioned what would be the basic needs of the population for the healthcare needs. Next question is, who is responsible for WHO International Drug Monitoring Program? Which body or which statutory body is going to take the responsibility of the WHO International Drug Monitoring Program? Options are Uppsala Monitoring Center, or WHO Drug Dictionary, or PVPI centers, or Contract Research Organization. And the right answer is Uppsala Monitoring Center, because World Health Organization program for the international drug monitoring, that is PIDM, is administered by the WHO headquarters in Geneva, and the Uppsala Monitoring Center is in Sweden, and this center is going to take the responsibility of the WHO international monitoring programs. Next question is, which one of the following is not a term associated with the therapeutic drug-drug interactions? Means, from all these options, which option is correct according to this question, which is not associated with the therapeutic drug-drug interactions? And the options are synergism, antagonism, oxidation, or the addition. And the right answer is option number C, that is oxidation. Because if we are going to administer two drugs at a one time, either it will act as a synergistic drug or it will produce adverse effects. That means it can give additive or the therapeutic effects more significantly as compared to the single drugs. So no therapeutic effect will be produced after that. If a drug-drug interaction we are going to concern, it is a most important point to concern regarding that, because oxidation is not a term associated with the drug-drug interactions. Next question is, which of the following is not an advantage of the coding system for the materials? According to this question, which option would be the correct, which is not an advantage of the coding system or not an beneficial for the coding system of materials? And the options are, it will helps to identify spurious drugs, or it will assist in keeping records, or it facilitates quick identification, or it eliminates the chances of duplication. And the right answer is, it helps to identify spurious drugs. This option would not be correct for the coding system of materials. It is not an advantage of that particular, because the advantages of the coding systems of the materials of the substances are, it will assist in keeping records, and it will also facilitates in quick identification of any particular material or any particular substance, and it will also eliminates the chances of the duplication. These are the benefits or the advantages of coding system of any materials. Next, last question is, DIS provides guidance of. DIS, that is Drug Information Services, provides the guidance on what? Options are educational programs, or pharmacy research projects, or both A and B. That means ki A and B options are correct, and the last one is none of these. And the right answer of our last question is option number C. Drug Information Services provides the guidance on educational programs as well as on pharmacy research projects. That is why they are helping in improving patient safety, and as well as they are also helping or guiding in minimizing drug related issues of the patients, and what would be the rational use of the drugs by both, that is physicians and the patients. They are guiding throughout in these particular points, that is Drug Information Services. So this is our mock paper 6, which will be helping you in your preparation of Telangana pharmacist. You can go through I'm recommending you a one book, which is Mission Pharmacist, and through this book you are going to get 30 years previous year papers of various state and central level pharmacist exam, by which if you are going to go through these 30 years paper question, previous year paper questions, so you are going to do a practice of that particular questions, and it would be helping automatically in your Telangana pharmacist preparation. You can order this book from the Flipkart, and in Flipkart cash on delivery is also available. And if you are having any query regarding any particular point, you may call on this number, And for the non-pharma portion, that is reasoning, general knowledge, general science, you may go through the non-pharma kit. It is also available on the Flipkart, and as well as COD is also available. So you can order that book. We have provided the links of Mission Pharmacist and as well as of non-pharma kit in the descriptions itself. And you may follow us through various platforms, that is WhatsApp and Telegram. We have provided the links of these channels in the description. You may follow from there also. And you are going to get the PDF of this mock paper in Telegram channel also. So for more amazing videos, stay connected with Pharmacy India and prepare for your Telangana pharmacist with us. Jai Hind.